Have you ever felt like your body was trying to send you signals, but you couldn't quite decipher them? What if something as subtle as a change in odor could serve as an early warning sign of a serious disease like cancer? It may seem surprising, but the reality is that your body often provides clues, and ignoring them could mean losing valuable time. Cancer, one of the most devastating diseases worldwide, doesn't always make itself known with obvious symptoms. In fact, some of the earliest warning signs might manifest as changes in body odor, breath, or sweat. Think of these smells as quiet alerts, signaling that something might be off. Would you recognize them? In today's video, we'll uncover 8 cancer-related odors that many people tend to overlook, signals that could be crucial in detecting the disease in its early stages. This knowledge could be life-saving, so be sure to stay with us until the end. Let's dive in. You might be wondering, how does cancer influence body odor? The answer lies in how the disease disrupts your body's natural processes. Cancer often triggers subtle but significant changes in metabolism, leading to the production of specific chemical compounds. These substances, known as volatile organic compounds, VOCs, can alter the way your body smells, including your breath, sweat, and even urine. Here's something fascinating. Research has shown that certain cancers, such as lung cancer, skin cancer, and bladder cancer, produce distinct chemical markers that the body releases into the air. These compounds are often undetectable to humans, but can be identified by trained animals, particularly dogs. In fact, specially trained dogs have been able to detect cancer in its early stages with remarkable accuracy, sometimes even before medical tests reveal anything unusual. But it doesn't stop there. Scientists are now developing advanced technologies that mimic a dog's sense of smell to identify these compounds. Devices like electronic noses could revolutionize cancer diagnosis, making it possible to detect the disease simply by analyzing a sample of breath or sweat. While this technology is still in development, paying attention to your body's natural signals remains essential. A persistent, unexplained odor that doesn't go away could be more than just an odd occurrence. It might be your body's way of urging you to take action. Ignoring these subtle signs could mean missing the opportunity for early detection when cancer is still manageable and survival rates are highest. The idea that cancer could be identified through odors may seem unexpected, but it is a concept rooted in scientific research. The human body is constantly sending signals, sometimes through visible or physical symptoms, and other times through unexplained changes in scent. These odors, though subtle, could be vital clues if recognized early. So, how can you tell when something is wrong? What specific smells should you be aware of? In the next section of this video, we'll reveal the 8 most common odors that could indicate different types of cancer. By staying informed and paying close attention to these subtle changes, you'll be better prepared to take action early, and that could make all the difference. Let's explore these signals together, because early detection is crucial, and your health is worth it. 1. The hidden mold, a warning sign for mouth and throat. Cancer mouth and throat cancer are serious conditions that can be difficult to detect in their early stages. One of the most unexpected and rarely discussed signs of these cancers is a distinct odor resembling mold or decaying wood. This distinct odor is caused by several factors, including secondary infections, tissue breakdown, and the release of volatile compounds from tumors in the mouth or throat. As cancer progresses, these compounds accumulate, leading to a characteristic smell. People around someone with this symptom may notice the odor when conversing with them, as it is most prominent on their breath. Unfortunately, this scent is often mistaken for poor oral hygiene or dental issues, which can delay seeking medical attention. The musty smell is usually accompanied by other key symptoms such as persistent hoarseness, difficulty swallowing, mouth or throat sores that don't heal, white or red patches in the mouth, and even unexplained ear pain. If this odor appears alongside these symptoms, it is crucial to consult a specialist, such as an otolaryngologist or oncologist. Diagnostic tests like biopsies, CT scans, or MRIs can help determine the underlying cause. Although mouth and throat cancer are serious conditions, early detection significantly increases the chances of successful treatment. That's why it's important not to ignore unusual changes in breath or other symptoms related to the mouth and throat. If you notice a persistent musty odor or any accompanying warning signs, take action immediately. The sooner the disease is identified, the better the chances of a positive outcome. The scent of decay, a warning sign for colorectal cancer. Colorectal cancer ranks among the leading causes of cancer-related deaths worldwide, yet its early warning signs are often overlooked or mistaken for common digestive issues. One such sign is a noticeable change in the odor of stool. It can become much stronger, more persistent, and resemble the scent of decomposition. This unusual smell occurs because colorectal cancer disrupts the digestive process, leading to the release of toxins and gases that alter the normal scent of stool. These changes may be linked to incomplete digestion or the buildup of harmful substances in the intestines. While diet and medications can naturally influence stool odor, a persistent, unexplained scent of decay should raise concern. This odor may also be accompanied by other troubling symptoms, such as blood in the stool, ongoing abdominal pain, changes in bowel habits, and unexplained weight loss. One of the reasons colorectal cancer is particularly dangerous is that many symptoms, including alterations in smell, often do not appear until the disease has progressed. That's why paying attention to changes in odor could be one of the few early warning signs before the condition worsens. If you experience persistent changes in stool odor, consult a doctor without delay. Tests such as colonoscopies, stool analysis, and imaging scans can help detect abnormalities in the intestines. The positive news is that colorectal cancer has a high cure rate when diagnosed early. Being aware of subtle bodily changes, such as the described odor, can be life-saving. The frightening sweet smell, a possible indicator of breast cancer. Breast cancer is one of the most common cancers among women, though it can also affect men in rare cases. One of the lesser-known and more unusual signs of this disease is a sweet yet unpleasant scent that may emanate from the skin or open wounds associated with the tumor. This scent is especially noticeable in more advanced stages of the disease when infections or tissue breakdown occur in the affected area. As cancer cells multiply uncontrollably, they can trigger inflammation and localized infections, leading to the release of chemical compounds that produce this distinct odor. Open wounds or ulcers on the breast are often the primary source of this smell. The sweet scent may be mistaken for a simple infection or poor hygiene, but its persistence should serve as a warning sign of a more serious issue. Beyond changes in smell, breast cancer often presents with additional symptoms such as lumps in the breast or underarm, alterations in skin texture or color, abnormal nipple discharge, and ongoing pain in the area. If any of these symptoms appear, especially alongside an unusual, sweet yet unpleasant odor, seeking immediate medical evaluation is essential. One of the biggest challenges with breast cancer is that early symptoms are often dismissed as harmless, delaying diagnosis and reducing the likelihood of successful treatment. However, breast cancer has a high cure rate when detected early. This is why recognizing signs, including unusual smells, can be life-saving. If you or someone close to you notices persistent skin odor, changes, or sores in the breast area, do not hesitate to consult a doctor. 4. Sulfur-like breath, a possible indicator of stomach cancer. Stomach cancer is a stealthy disease that often develops with vague and easily overlooked symptoms. However, one of its most distinctive warning signs is a breath odor that resembles sulfur or rotten eggs. This occurs because stomach cancer disrupts digestion, leading to the release of sulfurous gases in the digestive tract. When the stomach can no longer properly process food, volatile compounds are produced, resulting in this characteristic smell. Unlike ordinary bad breath, this odor is persistent and does not improve with oral hygiene or dietary adjustments. Many people mistake this symptom for common digestive issues such as acid reflux or gastritis, but its ongoing presence should not be ignored. Stomach cancer can also cause additional warning signs, including abdominal pain, a constant sensation of fullness, appetite loss, frequent nausea, and in advanced stages, blood in the stool or vomit. One of the main reasons gastric cancer is often diagnosed late is because its symptoms closely resemble those of more common and less serious conditions. However, the presence of a persistent sulfur-like breath odor could be an early clue that something more serious is occurring. Recognizing this change, along with other digestive symptoms, could make the difference between early detection and discovering the disease at a more advanced stage. If you notice a lasting change in your breath, along with digestive discomfort, consulting a gastroenterologist for an evaluation is crucial. Early detection of stomach cancer significantly increases treatment, success, and survival rates. The terrifying scent of rotting flesh, a warning sign of skin cancer. Skin cancer, particularly melanoma, is one of the most dangerous forms of cancer. While it can manifest in various ways, one surprising symptom is a distinct and unpleasant odor. Individuals with advanced skin cancer often report a smell resembling rotting flesh or decay. This odor arises when cancerous cells begin to break down, releasing volatile chemical compounds responsible for the offensive scent. The scent of decomposition is most noticeable in open wounds or skin lesions that fail to heal properly. Despite being subtle, this metallic scent can serve as an early warning sign of blood-related cancers. One reason it often goes unnoticed is that it can be mistaken for normal body odor, dietary influences, or even environmental factors. However, when combined with other concerning symptoms, this odor should not be ignored. Additional warning signs of leukemia or lymphoma include persistent fatigue, frequent infections, unexplained bruising, swollen lymph nodes, and excessive night sweats. If you experience these symptoms alongside a persistent metallic odor, it is crucial to consult a doctor as soon as possible. Blood cancers can progress quickly, but early detection significantly improves treatment outcomes. Many people dismiss subtle bodily changes, assuming they are insignificant. However, being aware of these hidden signals, such as a metallic scent, can lead to earlier diagnoses and better chances of recovery. If you or someone close to you notices an unusual metallic smell in their sweat or breath, especially when accompanied by other symptoms, seek medical advice promptly. 6. A fruity scent that hides a risk. The smell of liver cancer. Liver cancer is another disease that often remains undetected until it reaches an advanced stage. However, a lesser-known warning sign is a distinct fruity or sweet-smelling body odor. This occurs due to metabolic disruptions caused by liver dysfunction. When the liver is no longer able to process toxins efficiently, excess ketones and other chemical compounds accumulate in the bloodstream. These compounds can alter body odor, creating a scent reminiscent of fermented fruit or acetone. This is similar to the smell sometimes detected in people with uncontrolled diabetes. Although many factors can influence body odor, including diet, medications, and metabolic conditions, persistent changes in smell, especially when combined with other symptoms, should not be ignored. Other warning signs of liver cancer include jaundice, yellowing of the skin and eyes, unexplained weight loss, loss of appetite, chronic fatigue, and abdominal swelling. One of the biggest challenges with liver cancer is that its symptoms often resemble those of less serious conditions, leading to delays in diagnosis. However, recognizing subtle changes, such as an unexplained fruity scent, could provide an early clue that something is wrong. If you notice persistent changes in body odor, particularly a sweet or fruity smell, along with other concerning symptoms, it is essential to consult a healthcare professional. Early detection of liver cancer can make a significant difference in treatment success and survival rates. Final thoughts. Listen to your body's signals. Our bodies constantly send us signals, and sometimes these messages come in the form of scent. While body odor changes can have many causes, some may indicate underlying health issues, including cancer. Ignoring these subtle cues could mean missing an opportunity for early diagnosis and effective treatment. By paying close attention to changes in breath, sweat, urine, or skin odor, especially when accompanied by other symptoms, you can take proactive steps toward better health. If you notice persistent, unexplained odors, don't hesitate to seek medical advice. Remember, early detection saves lives. Stay informed, stay aware, and prioritize your health. One of the biggest challenges with this symptom is that, being subjective and not causing immediate discomfort, it is often overlooked. Many people attribute the smell to environmental factors, diet, or hygiene, failing to recognize that it could be a serious warning sign. In addition to the metallic odor, leukemia and lymphoma present other concerning symptoms, including extreme fatigue, persistent fever, recurring infections, and unexplained weight loss. If this metallic smell appears alongside these warning signs, seeking medical attention should be a top priority. Leukemia and lymphoma can progress rapidly, but early detection significantly improves the chances of successful treatment. If you notice a persistent metallic scent, particularly on your breath or sweat, don't dismiss it. Consider it a potential alert from your body urging immediate attention. Next, we'll discuss an even stronger and more recognizable scent, the pungent ammonia-like odor, which could signal kidney issues. The unwanted sweet scent, a warning sign of lung cancer. Lung cancer is one of the most insidious and life-threatening cancers, often developing without obvious symptoms for an extended period. However, in some cases, an unexpected indicator emerges, an unusual smell. Some individuals with lung cancer report a sweet, slightly fruity odor emanating from their breath. This distinct scent results from volatile organic compounds released by the lungs. As cancerous cells disrupt normal metabolism, these compounds accumulate and become noticeable. Although the smell is somewhat reminiscent of fermented or decaying fruit, it differs from typical bad breath. It lingers despite oral hygiene efforts and remains persistent over time. Unfortunately, this early warning sign can go undetected for months, as it is often mistaken for digestive issues or even diabetes. That's why paying close attention is crucial, especially if the odor occurs frequently and lacks an obvious cause. Lung cancer often presents additional symptoms that, when combined with this scent, warrant medical investigation. These may include a persistent cough, difficulty breathing, hoarseness, and chest pain. If you notice these signs, seeking immediate medical attention is essential. Lung cancer remains one of the deadliest cancers, but it also has better treatment outcomes when caught in its early stages. Recognizing a persistent, sweet and fruity breath odor could be a key factor in early detection and ultimately saving lives. Your body's subtle warnings. Are you listening? It's astonishing to think that something as seemingly insignificant as a smell could serve as the first signal of a serious disease. Our bodies are remarkable, continuously sending signals, sometimes through visible symptoms and other times through more subtle, unexpected changes. The odors we've discussed may seem trivial, but for those paying attention, they can be critical, even life-saving clues. Early detection remains one of the most powerful tools in the fight against cancer. By listening to our bodies and acting swiftly, we gain valuable time, more treatment options, and a better chance of overcoming illness. Never ignore persistent, unusual smells or other unexplained symptoms. Every moment matters, and prioritizing your health is always worth it. If you or someone you care about has experienced any of the warning signs we've covered, don't wait. Seek medical advice as soon as possible. Taking action today isn't just a choice for yourself, but also an act of love for those who care about you. Life is our most precious gift. By staying informed and spreading awareness, we can encourage others to take charge of their health and potentially save lives. Remember, your body speaks to you. It's up to you to listen. Now, the question remains, will you act on what you've learned, or will you let these signals go unnoticed? Don't wait. The time to act is now. If you found this information valuable, give this video a thumbs up, share it with others, and subscribe to Healthy Every Day for more essential health insights. Together, we can spread awareness and empower more people to take control of their health. Stay informed, stay healthy, and we'll see you in the next video.